Welcome to today's video about early signs of heart failure. Your body might be trying to warn you right now, but you could be missing these signals. Over 6 million Americans are living with heart failure today. The scary part: most people don't notice the warning signs until it's too late. Here's what you need to know. Most people think these symptoms are just part of getting older or being stressed. They ignore them, but your heart is actually crying out for help. Today, I'm going to show you 13 early warning signs of heart failure that almost everyone misses. Some will surprise you, like a strange feeling when you bend down to tie your shoes, or why you suddenly need more pillows at night. By the end of this video, you'll know exactly what to look for and when to see a doctor. These signs could save your life. Before we start, remember this video is just for information. It's not medical advice. Always talk to your doctor. All our facts are backed by research, and you'll find links in the description. Now let's jump into warning sign number 1. Warning sign 1. Getting out of breath. Easily the first sign most people ignore is getting out of breath during simple activities. This isn't about being tired after a hard workout. I'm talking about losing your breath, climbing one flight of stairs, or walking to your mailbox. Things that used to be easy now make you stop and catch your breath. The American Heart Association says this is one of the earliest signs of heart failure. What's happening is simple. Your heart can't pump blood well enough to give your muscles the oxygen they need. So when you move around, your lungs work extra hard to make up for it. You feel breathless. Here's the key difference. Normal tiredness is one thing. But if activities that were once easy now leave you gasping for air, that's your heart asking for help. Studies show this symptom can appear months before other obvious problems. Don't just blame it on being out of shape. This could be serious. Warning sign 2. Needing more pillows to sleep. Here's something that happens so slowly you might not notice it's wrong. You keep adding more pillows to sleep comfortably. This has a medical name: orthopnea. It's a clear sign your heart is struggling. When you lie flat, your heart has to work harder to pump blood from your legs back up. If your heart is weak, blood starts backing up in the vessels going to your lungs. This forces fluid into your lungs, making it hard to breathe when you're lying down. Research shows 80% of heart failure patients have this problem. But it creeps up on you. First, you use one extra pillow, then two. Then maybe you end up sleeping in a chair because it's the only way you can breathe. People think it's just a preference. But if you've gone from sleeping flat to needing to prop yourself up just to breathe, your heart is sending you a message. Don't ignore it. Warning sign 3. Waking up gasping for air. Picture this. You wake up suddenly in the middle of the night. You can't breathe. You're gasping for air, feeling like you're drowning. Your heart is pounding. You're scared. You have to sit up or stand just to catch your breath. This terrifying experience has a name: paroxysmal nocturnal dyspnea. It's a serious warning sign. This happens because when you lie down for hours, fluid from your legs moves to other parts of your body, including your lungs. Your weak heart can't handle this extra fluid, so you wake up unable to breathe. Studies show this usually happens 2 to 4 hours after you fall asleep. People often rush to a window, desperate for fresh air. The dangerous part: many people think it's just nightmares, anxiety, or sleep problems. But if you're waking up gasping for air, especially if it's happening more often, you need to see a doctor right away. This is your heart screaming for attention. Warning sign 4. Constant exhaustion. Warning sign number 4 is the one most people brush off: feeling exhausted all the time. This isn't regular tiredness that gets better after rest. This is bone-deep exhaustion that never goes away, even after sleeping well. Activities you once loved now feel impossible. Here's what's happening. Your weak heart can't pump blood efficiently, so your body sends blood to the most important organs first: your heart and brain. That means your muscles get less oxygen-rich blood. The result: you feel weak and tired all the time. What's really concerning is how this affects your stamina. You might notice it takes forever to recover after doing anything physical. A short walk that used to energize you now means you need a long rest. Carrying groceries, climbing stairs, even taking a shower becomes exhausting. The decline is so gradual that people adjust without realizing it. They stop doing activities, they make excuses, they blame getting older. But this isn't normal aging. This is your heart struggling to keep up with your body's basic needs. Pay attention to this warning sign. Warning sign 5. Swollen ankles and legs. One of the most visible early signs is swelling in your ankles, feet, or legs. Doctors call this peripheral edema. This isn't the temporary puffiness from sitting too long. This is persistent swelling that keeps getting worse, especially by the end of the day. When your heart can't pump well, blood doesn't move properly and starts pooling in your lower body. Plus, your kidneys aren't getting enough blood, so they hold on to salt and water. This combination pushes fluid from your blood vessels into your tissues, causing swelling. Research shows about 70% of heart failure patients have this swelling when they're diagnosed. It usually starts in the feet and ankles and can move up your legs. Your socks leave deep marks. Your shoes feel tight by evening. Rings that fit in the morning feel too tight by afternoon. The pattern matters. Heart failure swelling usually affects both legs equally and gets worse as the day goes on because of gravity. If you press on the swollen area and it leaves a dent that stays for several seconds, this could be a warning sign you need to take seriously. Warning sign 6. Rapid weight gain. This is the most measurable early warning sign. Gaining weight fast because of fluid buildup. I'm not talking about slowly gaining weight from eating too much. This is sudden weight gain that happens in just a few days, and it should set off alarm bells. The American Heart Association says gaining 2 to 3 pounds in one day or 5 pounds or more in a week means you need to call your doctor immediately. This rapid weight gain happens because your failing heart triggers reactions that make your kidneys hold on to salt and water. Every 2 pounds of weight gain equals about 1 liter of extra fluid in your body. Studies show this weight gain happens before other symptoms become obvious. You might not see swelling or feel short of breath yet, but the scale tells the truth. This is why doctors tell heart failure patients to weigh themselves every day. It's an early warning system that can prevent hospital stays. Heart failure weight gain is different from normal weight changes. It's consistent, it keeps going up, and you often feel bloated or full. If you're gaining weight this quickly without changing your eating habits, don't wait. See your doctor. Warning sign 7. Waking up to urinate. Often a confusing symptom is suddenly needing to pee more at night than during the day. While many people blame age or drinking water before bed, this could actually be an early sign of heart failure that gets overlooked. During the day, when you're up and moving, gravity pulls fluid down to your legs. Your struggling heart can't pump this fluid back to your kidneys effectively. But when you lie down at night, gravity helps push this pooled fluid back into your bloodstream. Your kidneys suddenly get this flood of fluid and work overtime to process it, making more urine. Studies show frequent nighttime urination can be one of the earliest signs of heart failure, sometimes appearing before more obvious symptoms. Patients often wake up 3 to 4 times per night to urinate, with larger amounts each time. This pattern is important because it shows your heart can't handle normal fluid distribution during the day. If you're suddenly waking up multiple times every night to use the bathroom, and this is a new pattern for you, talk to your doctor about it. Warning sign 8. Night cough. When lying down, a persistent cough that only happens at night, or when lying down, is another subtle but important warning sign. This isn't the cough from a cold or allergies. It's a nagging dry cough that disrupts your sleep and gets better when you sit up. This nighttime cough happens for the same reason you need extra pillows. When you lie flat, fluid redistributes in your body and can build up slightly in your lungs. Your body tries to cough to clear what it thinks is blocking your airways. Medical journals describe this cough as often being worse in the early morning hours, sometimes with a slight wheeze. Patients say the cough produces little or nothing, or occasionally brings up white or pink frothy mucus, a sign that fluid is in the lungs. This symptom is tricky because people blame it on allergies, postnasal drip, or their bedroom. They don't realize their heart is the real problem. If you have a persistent cough that's worse at night and better when sitting up, especially with other symptoms on this list, get it checked out. Warning sign 9. Feeling your heart racing or skipping your heart's rhythm can give you crucial early warnings. Palpitations, feeling your heart flutter, pound, or skip beats, often happen in early heart failure as your heart works harder to pump blood effectively. When your heart muscle weakens, it may develop irregular rhythms as it struggles to keep blood moving. You might feel your heart racing even when resting, or feel like your heart is skipping beats. Some people say it feels like their heart is doing flips in their chest. Research shows heart rhythm problems, especially atrial fibrillation, both cause and result from heart failure. It's a two-way street. Irregular rhythms can lead to heart failure, and heart failure can trigger dangerous rhythms. This creates a cycle that can quickly get worse if not treated. These palpitations are often more noticeable when you're resting or lying down and may come with anxiety or unease. While palpitations have many causes, when they happen with other heart failure symptoms, they need serious medical evaluation. Don't dismiss them. Warning sign 10. Dizziness or nearly fainting. Dizziness, lightheadedness, or nearly fainting can be frightening early signs of heart failure. These happen because your weak heart can't pump enough blood to keep adequate circulation to your brain, especially when you change position or exert yourself. When you stand up quickly or exert yourself, your body normally compensates by increasing heart rate and adjusting blood vessels to maintain blood pressure. But a failing heart can't make these adjustments, leading to temporary drops in blood flow to the brain. This causes dizziness, lightheadedness, or in severe cases, fainting. Studies show fainting occurs in about 20% of heart failure patients and can be an early warning sign, sometimes before other obvious symptoms. Episodes are often triggered by sudden movements, standing for long periods, or mild exertion that wouldn't have bothered you before. This symptom is dangerous because people blame it on dehydration, medication, or ear problems. While these can cause dizziness, when combined with other heart failure symptoms, this represents a serious decrease in how much blood your heart is pumping. Take it seriously. Warning sign 11. Bloating and poor appetite. Digestive symptoms might seem unrelated to your heart, but persistent bloating, loss of appetite, or feeling full after eating tiny amounts can be early heart failure signs. Heart failure doesn't just affect your heart, it impacts your entire circulatory system, including blood flow to your digestive organs. When your heart can't pump well, blood flow to your digestive tract decreases. Also, fluid can build up in your abdomen, and your liver can get congested with blood that isn't being pumped efficiently. This creates digestive problems that significantly impact your life. Research shows these digestive symptoms are often overlooked because they seem unrelated to heart problems. Patients report feeling uncomfortably full after just a few bites, persistent nausea, or bloating that doesn't go away with normal remedies. Liver congestion from heart failure can also cause pain in the upper right side of your belly. Some describe a constant feeling of pressure or fullness that makes eating difficult. If you're experiencing unexplained digestive issues along with other symptoms on this list, your heart might be the culprit. Warning sign 12. Can't breathe when bending forward. Here's a symptom so specific most people have never heard of it, yet it's one of the most telling signs. Bendopnea. This is shortness of breath that happens within 30 seconds of bending forward, like when tying your shoes, picking something up, or leaning over a sink. This symptom was first studied in 2014. And research shows it's a remarkably specific indicator of high heart pressures. When you bend forward, the position increases pressure in your abdomen, pushing against your diaphragm and temporarily increasing pressure in your chest. If your heart already has high filling pressures, this extra stress quickly triggers breathlessness. Studies found bendopnea is present in about 30% of heart failure patients, and is strongly linked to more advanced disease and increased mortality risk. The symptom is so reliable that researchers consider it a non-invasive way to assess heart pressure without invasive testing. What makes this particularly significant is its specificity. Healthy people rarely experience this. If you consistently get short of breath within 30 seconds of bending forward, this deserves immediate medical attention. It's your heart telling you the pressures inside are too high. Warning sign 13. Cold hands and feet. The final warning sign involved circulation changes you might notice in your hands and feet. Cold extremities, even in warm weather, can indicate your heart isn't pumping with enough force to maintain proper circulation throughout your body. When heart failure develops, your body prioritizes blood flow to vital organs like your brain and heart, reducing circulation to your hands and feet. This leads to persistently cold extremities, sometimes with a bluish tinge to fingernails or lips. You might notice your hands and feet feel cold to the touch, even when you're warm, or they take much longer to warm up than usual. Medical research shows these circulation changes often develop gradually and can be early indicators of decreased cardiac output, while cold hands and feet can have other causes. When combined with other symptoms from this list, they warrant medical evaluation. Take action now. If you recognized yourself in any of these 13 warning signs, don't panic, but absolutely don't ignore them either. Heart failure, when caught early, is manageable. The key is recognizing these subtle signals your body is sending and taking action before a medical emergency happens. The most important thing to remember is these symptoms often develop slowly and can be easy to dismiss. You might think you're just getting older, out of shape, or stressed, but when multiple symptoms appear together or familiar activities become unexpectedly difficult, your heart is telling you something critical. Early detection and treatment of heart failure can dramatically improve your quality of life and how long you live. Modern medicine has incredible tools to help manage heart failure, from medications that strengthen your heart to lifestyle changes that can slow or even reverse the disease's progression. Don't wait. If you're experiencing these symptoms, talk to your doctor. Your life could depend on it. If this video was helpful, type helpful in the comments. That motivates us to create more content like this. Please like, share, and subscribe for more life-saving health information. Thank you for taking charge of your heart health. Your future self will thank you.